Hi everyone. Thank you for joining me again in my backyard. I hope very much we can be together in person for next year's Shane Foundation spring event. It's been quite a year since you saw me in our Shane Foundation 2020 video. Of course, the world has changed so much, but the need to protect women and girls from deadly blood clots caused by certain contraceptives and pregnancy remains. As you know, my beautiful sister Shane, while 7 months pregnant, died of preventable treatable blood clots. And before that, she suffered from blood clots caused by birth control called Yasmin. Through the work my sister inspired, the Shane Foundation is working on public health communication programs designed to arm women with information about the risks of these blood clots. Whether or not she can read or speak English, every woman and girl should be armed with the ability to recognize symptoms and advocate for herself by communication with a medical professional. The work of the Shane Foundation also focuses on research into who will develop blood clots and how they can be prevented and treated. This year, for our annual spring event, we want our donors to meet the doctors at Northwestern University Feinberg School of Medicine who are bringing the Shane Foundation mission to life.
Hi, I'm Paloma Toledo. I am an obstetric anesthesiologist at Northwestern Memorial Hospital.
Hi, I'm Caitlin Newman. I'm one of the OB anesthesia fellows at Northwestern University, and I also have a background in education. I've received my master's in education.
We work together at Northwestern Prentice Women's Hospital. This is one of the largest delivery hospitals in the United States. We have approximately 11,500 deliveries a year. And one area that we're particularly interested in is educating patients, particularly around things that should be of concern to them during their pregnancy and postpartum period. I recently delivered an infant, and these were my discharge instructions. As you can see, it tells you important information, but it's not in a very patient-friendly way. It's single space, there isn't any emphasis on what's important, and it really lacks that what you should do if there is something of concern. Roberta Gold actually led the National Council on Patient Safety Task Force that developed the urgent maternal warning signs. And as you can see here, it has images that tell patients what should be of concern, but there are some limitations with this project, which is where we are picking up with the current project funded by the Shane Foundation.
So we are working on a current peripartum patient education study where really our aim is to develop a visual aid education tool so that patients know when to report to an obstetrician or the emergency room. We hope that this is also an educational tool for providers to help aid in their discussions in their own patient education. So our image goals are to basically create new images that are going to increase inclusivity, that are going to help improve understanding and also really emphasize the seriousness and the urgency of these warning signs and symptoms. We hope that there is improved anatomical accuracy, yet the images remain simplistic in nature. And our goal is to provide differentiated material to really provide access to all patients of varying healthcare literacy. This is an example of one of the new images that we are creating. Dr. Naveen Nathan is spearheading this and really just provides improved education for patients.
With that, we would like to thank the Shane Foundation for partnering with us in this important work, and particularly we would like to thank Roberta for lending us her expertise in education as we move forward with this project. Thank you.
Thank you.
Thanks to our donors, the Shane Foundation has become a national leader in developing maternal health patient education. Because of you, the Shane Foundation has been able to focus this effort at one of the largest birthing facilities in the United States. Many thanks to Drs. Toledo and Newman. Please help us ensure that this important project can reach its full potential. Visit shanefoundation.org and support us by clicking Donate. Every girl, every woman, every baby deserves a chance to live a long, healthy life free of devastating and lethal blood clots. If you haven't donated before, now is the time. If you've donated in the past, thank you so much. And please consider increasing your support for 2021 so that we can do more good in this world together. Thank you for your generosity. Be well, and I hope to see you soon.